Hello, everyone. My name is Cheryl Matthews. Today, I am talking about an important topic regarding women's health, specifically reproductive disorders. The topic will focus on endometriosis, the unseen scars. During that time of the month, women can experience different kinds of pain levels when dealing with their menstrual cycle. However, some women's symptoms may be more severe and cause heavier blood flow, intense pain, nausea, and limit their daily schedule. When that happens, there could be another explanation to this painful development. For instance, endometriosis could cause these painful features for women during their menstrual cycle. Endometriosis can be a serious condition since tissues like the uterine lining are growing outside of the reproductive organs, which can cause intense pelvic pain and bleeding during a woman's period. Even though endometriosis can occur at any age or time frame, most women tend to develop the disorder in their 30s or 40s. From this diagram, endometriosis causes abnormal growths and tissue development not normally seen around the uterus. This abnormal growth can lead to chronic pain in the pelvic region for women during their menstrual cycle or throughout their normal day. With the intensity of endometriosis, different policies and programs have tried to address the issue. However, I have proposed a policy that could help to manage the various challenges that endometriosis can cause. My proposed policy is known as the Health, Outreach, Policy, and Education for Endometriosis, otherwise known as the HOPE Act, which seeks to raise awareness and educate people on the disorder. This policy will mainly focus on how to improve the medical community's recognition and evaluation of endometriosis within female patients and what steps can be taken to properly diagnose the condition. Within the medical field, a lot of medical professionals tend to lack the proper education on symptom recognition of endometriosis within the female population. With the HOPE Act, physicians, nurses, CNAs, and other medical physicians will be required to take continuous education courses. By doing this, these medical professionals will be able to properly recognize endometriosis. Also, questionnaires will be a tool frequently implemented by nurses or physicians for female patients so that daily occurrences and symptoms can be recorded and provide evidence to diagnose endometriosis within these individuals. Studies have also shown how questionnaires are great tools to diagnose female patients more accurately as well. Within the HOPE Act, there are different actions that will be implemented. For instance, the Act will ensure that physicians in any position will be more equipped in diagnosing endometriosis, which will hopefully increase diagnostic rates. Through frequent education, physicians can also accurately diagnose female patients and begin the treatment process early to help manage symptoms better. Education to the surrounding community can also help to lower stigmas of women's reproductive disorders and pain levels. The HOPE Act also investigates research opportunities for better treatment options and to discover how the disorder develops. However, there are downsides to the HOPE Act. For instance, endometriosis does not have a cure, and the development of the disease is unknown. This would indicate further research to be conducted, Yet research efforts will require some kind of funding that federal or state level may not want to provide. This can be due to a variety of factors. Federal or state governments may not see the importance of endometriosis research, since there is a low diagnostic rate, and they may not be able to justify research or clinical trial funding due to this low diagnosis. Also, lack of education regarding the severity of endometriosis may also lead to the government not providing financial backing. Endometriosis also has a sporadic diagnostic rate, which can limit a proper clinical trial to form. Women's pain levels, on the other hand, are not taken seriously by providers and tend to go under the radar or underdiagnosed compared to male patients. The HOPE Act could be a beneficial policy for women who suffer from endometriosis. The act will help to ensure that medical professionals in a clinical and hospital setting are more equipped in recognizing symptoms and properly diagnosing patients. It will also seek collaboration with health insurance companies, as well as Medicare and Medicaid, to assist with financial costs. Lastly, funding opportunities such as fundraising campaigns and partnerships with medical institutions such as the CDC will help to provide awareness and education for individuals. Thank you so much for taking the time to watch the video. I hope that you enjoyed and were able to learn a lot about endometriosis as well as my policy. Thank you.